The world is currently in a great transition, and I feel that leaders come to the global stage and somehow not be able to negotiate, bargain, and get products which is available for public good like vaccines and take it back to their own country.
The society rises and falls on the strength of the leadership. Particularly in health, if we don't have the quantity, the skills and quality of leadership that is required to take a group, a society, a country to the next level, then it's either that group, society, or whatever becomes stagnant or they regress.
There is more competitions. The resources is becoming very tight. We have more issues, climate change, security issues that the domestic funding cannot even address. And if you don't take a pragmatic steps now to train global public health leaders, then we are likely going to have crisis in the future.
So leaders are key to drive programs and also interventions and also even the country into a right direction, as you can see from the examples that we have faced as we are staying here in Rwanda for the past few days. So if you have the right leader, the right person and right mindset as a leader, it helps to progress the system and also help the general society.
Rwanda somehow in Africa seems to be a very good role model for a number of these things, including digital health, insurance. These are all fantastic kind of showcase models for the rest of Africa.
Rwanda, the community health insurance system, the whole processes, and all of that are quite practical and are really working. And the fact that it is, in-country driven, it's also quite motivating and not really donor dependent like what is obtained in some of our countries.
We've come here, we went through the communities. We have people that probably had never visualized those kind of communities at the level at which they operate. But this is what you can see, you can feel it. You can see the impact, you can talk about the experiences. You're exchanging ideas with people from other countries that understand you. And I think it just makes it so real.
The fact that it's practical, more so that it is not more of just classroom, you learn all the theories and you're unable to apply them. So as we are being trained, we are exposed to first-hand information by persons who have done so in their various countries or where things have worked, which is kind of really making it unique and practical, hands-on kind of training.
So now is the time to build the leaders that are empowered with the right information about what is the needs of the people when it comes to health need. 2, how do they prioritize in a resource-constrained environment? 3, the larger population that are at risk, we need to start now taking care of them.
These are the things that Africa really needs to negotiate with the rest of the world. And that voice and that thought leadership is something that I felt is very, very necessary for the future. And I think that's the business we are in. How do you take the current people who are in executive positions and just give them that training in a very short time, really pack in those skills which are going to help them be better negotiators, better leaders on the global world platform.